This is our first major event for the South African chapter. It's a newly formed chapter. We are about 1 year and I think 1 month old. And what we have managed to do is to meet in person once the people who are members of the chapter. And it was our friend Natalie Africa who was on the panel list. It was her idea and her initiative, and we are very happy for that. So we are now a number of people in South Africa who have attended ASHI in the past. I was there at ASHI in the 1980s, a very long time ago, but it was 10 fantastic and sometimes very difficult years. And it formed my life. And I think it has formed the lives of many of us. And we're very happy now to be able to be together, a few of us here in South Africa. I'm not South African, I'm Swedish, but I've lived in South Africa for about 20 years. And I would like to, together with my colleagues and friends from ASHI to some extent, to be able to give something back to this fantastic and wonderful and sad and very complicated and interesting country. There are many issues here in South Africa that we are thinking of addressing in our small way. We have very diverse backgrounds. I'm an economist and a statistician, and I've already worked here in South Africa, but I've become more and more interested in the environment. There's a lot to do on land and environmental issues, and I would like to be able to do something on that. We have other colleagues who have been working for example, for the ILO, for the International Labour Organization, and who also stay here in South Africa. We have Natalie, who is working for other organizations. And together, we would like to bring our diverse background and do something for this country. Now, with that, I would then like to give the word to Natalie, to give the word to Karine, I'm sorry, to give the word to Karine, I think, yeah, who is going to continue with the introductions. And thank you very much for attending, all of you. Thank you, Karine.
Thank you, Anna. Merci. Bonsoir à toutes et à tous et merci de nous avoir rejoints ce soir malgré notre retard pour cette vidéoconférence qui est organisée par le chapitre d'Afrique du Sud. Mon nom est Karine Leu, je suis responsable des relations avec les anciens élèves de cette maison et des réseaux professionnels. Je vais m'exprimer en français pour conserver le bilinguisme de cet événement qui est la norme à l'Institut, comme vous le savez. Je profite d'avoir la parole pour remercier également Zaninka, qui est étudiante de 2e année en études du développement et qui travaille avec moi et assure la partie technique de cet événement aujourd'hui depuis Kigali au Rwanda. Ceci pour vous dire que même si les relations se sont faites un peu plus distantes cette dernière année pour les raisons que l'on sait, nous avons aussi la chance et l'opportunité aujourd'hui d'avoir accès à des outils qui non seulement nous permettent de nous retrouver comme ce soir de manière internationale, mais également d'avoir accès à des sources et des ressources de savoir qui sont éloignées de nous et qu'il était impossible d'obtenir aussi aisément hier. Nous sommes près d'une trentaine maintenant en ligne et plus de la moitié d'entre vous ont obtenu leur diplôme en 2010, donc un public jeune. Permettez-moi enfin de vous présenter la coprésidente du chapitre d'Afrique du Sud et la présidente de l'association des anciens élèves de l'Institut, Madame Nathalie Africa. Militante dans l'âme, Nathalie est née et a grandi en exil en Zambie et au Zimbabwe. Son retour dans une Afrique du Sud libre et démocratique avait été le rêve de toute sa famille et c'est ce qu'elle a réalisé et fait après avoir obtenu son diplôme ici à l'Institut en 1992. Elle travaille en Afrique du Sud d'abord dans le secteur des ONG, le secteur des femmes, puis elle est recrutée par le ministère des Affaires étrangères pour être affectée à Paris comme conseillère aux affaires multilatérales et représentante de l'Afrique du Sud à l'UNESCO et à l'OCDE. Sa carrière l'amène ensuite au PNUD, chez HSBC et à la Fondation des Nations Unies à New York, où elle gère l'engagement du secteur privé pour chaque femme, chaque enfant. Et c'est un mouvement multilatéral que le secrétaire général des Nations Unies a aligné sur les objectifs du développement durable. Depuis mars 2020, Nathalie est conseillère principale du directeur pour l'Afrique à la Fondation Bill et Melinda Gates. Nathalie, Carlos, the floor is finally yours.
Thank you. Merci pour cette belle introduction, Karine. And thank you all for being with us. I looked at the list of who's on the phone from participants, and I see quite a few familiar names, and I'm seeing that you're from all over in the world. So welcome to all of you, and thank you for joining us. So I must say, for a long time, I knew about Professor Carlos Lopes, and I remember when he was the UN Executive Secretary General of the head of the UN Economic Commission for Africa. I used to read about his reports and everything, and I had an admiration for him from afar. And so when I returned to South Africa and we created this chapter of alumni, I saw something about Professor Lopes being a professor now at University of Cape Town. I couldn't resist, so I reached out to him and I said, we've just launched this chapter, so please could he join us for really our inaugural webinar of the chapter, and maybe even for the Africa region. I don't know if any other chapters in the Africa region have done something like this. So Professor, thank you so much for joining us. And I'm just going to briefly introduce you before we go into the discussion. So for everyone to know, Professor Lopes, as I mentioned, is currently honorary professor at the Nelson Mandela School of Public Governance at the Faculty of Commerce at the University of Cape Town, and also visiting professor at Sciences Po in Paris and associate fellow at Chatham House in London. Professor Lopes has had a very distinguished career. He has served as head of the UN Institute for Training and Research, MINITAR, the UN System Staff College, and as I mentioned, he's also been Under Secretary General and Executive Secretary of the UN Economic Commission for Africa. He served on many high-level boards, including the Global Commission for Economy and Climate, the Kofi Annan Foundation, as well as the board of our own Graduate Institute of International Development Studies, World Resource Institute, and others. So Professor Lopes joins us in being an alumnus of the Graduate Institute. He got his MA at Ashide, and he also has a PhD from Panthéon-Sorbonne University in Paris. He also holds honorary doctorates from a number of universities. So thank you so much, Professor Lopes, for being with us tonight.
Well, thank you very much for the invitation. I'm really very sorry that we could not start on time. You know, since we have some links with Switzerland, that's really shameful. We are supposed to respect time, but it was really a technical error that provoked it. And in fact, I'm quite used to WebEx. I don't know what happened, but somehow I could not connect with the speed that I wanted. So what I was supposed to do today is basically to talk a bit on the post-COVID world. What is the impact of the pandemic in Africa? And I would start by saying that we have experienced over the last 2 decades quite a significant number of developments in the continent that were considered positive and have inspired the Africa Rising narrative. In fact, that Africa Rising narrative has been quite biased by the view that now more opportunities existed in the continent, and there was high time to acknowledge that Africa had enormous potential, and therefore investors were overlooking real possibilities for a good return on investment. That's how the narrative started. You know, obviously it was justified by growth rates that are quite significant. In fact, the most important growth rates after Southeast Asia in terms of region. The fact that you had between 6 and 7 countries in the top 10 best performers of the world economy in the last 20 years and also the enormous potential that was associated with the fact that the demographic dividend was giving Africa a completely different dimension in terms of consumer market, but also because of the continental free trade area, the possibilities of regional integration. And I think all of this narrative conquered many spaces. Mainstream media that used to be quite hostile or pessimistic about Africa started to change a bit their perceptions. And as a result, we cannot really be completely, how should I put it, unsatisfied with this development. But this being said, this narrative was quite displaced because it was not taking on board the most interesting and important factor that we need to consider for Africa's development, and that is how much structural transformation is taking place in our economic reality. And in fact, the best way to define structural transformation is to say you have to move from low to high productivity. And the significant step in structural transformation in the literature is how you accelerate industrialization, because you capture with it higher productivity in the agricultural sector. You unleash opportunities for urbanization that are synergetic with the economy. And you also take on board the possibilities of formalizing the economic transactions, because industrialization type of relations require an administration that is much more sophisticated and formalizes transactions. So you reduce your informality, and therefore you uplift people from, sort of the margins of the economy to the center stage. So all regions of the world have experienced degrees of structural transformation, including Africa. But by all means, Africa is considered the least structurally transformed, also the least industrialized, therefore. And the issue was whether this Africa Rising narrative was really looking into this kind of aspects or not. And the answer is easy. It was not, because it was looking into the growth patterns in terms of the externalities that more or less define our relations with the world and the perceptions about our economies, and that those externalities are mostly based on our very high dependency on commodities and non-transformed commodities, to be more precise. In fact, to give you just a figure, 80% of exports or more being from commodities puts the country in the category of highly commodity dependent. And we have 35 countries out of 54 in Africa that are in that corner. So that's a huge amount of dependency. Not to mention that some of our largest economies, namely Nigeria, Angola, and Algeria, are very much dependent on commodity exports. South Africa and Egypt, that are also part of that top 5, are more diversified, as we know. But I wanted to tell you more about COVID and not about what I just mentioned, but I needed to give you this background because this is how we got into the discussion about how well is Africa performing. And this was the discussion just before COVID and the pandemic created new dimensions into how we perceive Africa's economic performance and therefore development performance. And what we knew is that in the last few years, because the commodity super cycle started to become, a retraction, because of the 2008-2009 financial crisis, because of the trade war between the US and China that basically created less demand for commodities and less transactions internationally, globally, and created some turbulence. because of all these factors that precede the pandemic, Africa was started to witness some getting back to the old narrative, and also the risk perception started to change back to the negative. Particularly because of debt levels, we started the century 2000 with about 20% debt to GDP ratio. And just before the pandemic, we were already at 50% debt to GDP ratio. And the pandemic has already brought us into more or less 60% debt to GDP ratio. So that was one factor. And because most analysts are used to perceive Africa from the externalities point of view, that becomes very, very visible, even though it's an element that should be put in its context. For instance, the fact that sovereign debt has become a worldwide phenomenon. It's not an African phenomenon. So all countries are incurring very large sovereign debt. Therefore, Africa could have been, perceived as just following the trend, but it's sort of isolated from the rest, because every time there are some confluence of negative elements, we go back to the old narrative, because it is a way of basically acknowledging that our development is quite fragile and that not enough structural transformation has taken place. So we immediately go back to the old narrative. So that's how we were just before the pandemic. And then the pandemic came, and basically it exacerbated all these trends. What the pandemic has done is to question the type of global governance that we were having, be it in terms of economic global governance, but also in terms of public goods global governance. We knew we were in a crisis. We were in a crisis that was exacerbated by the way we're dealing with climate. And in fact, climate has something to do with the pandemic, because it is our encroaching of environmental space that has created the opportunities for more mutations of viruses that eventually created this speed of a pandemic. There's nothing new with the pandemic. What is new is the speed, and because of the type of mutations that are now possible, given the way we have been behaving as human society with the environment and our lack of protection for environmental space. So the discussion about how we dealt with the climate was at its climax before the pandemic. And then the pandemic basically demonstrated that, yes, we're right to be worried about protecting the planet, but not just from the angle of climate, from all angles, including health. Because, the planet is a whole, and it's not separated in bits. So if you are going to take care of global public goods, you have to take care of them in their encompassing nature. And that includes, for instance, health. And then we realized that we cannot really deal with the global public goods dimensions without having some solidarity. And in order for us to govern solidarity, we need global policies, and we need a global response. So therefore, Africans found themselves, basically experiencing the short end of the stick. So if there is no good global governance, and there is a global phenomenon that is affecting everybody, it's very likely that the Africans are going to be the ones suffering the most from it. And therefore, the first predictions that came from all international organizations, including the UN, were that we were going to have 5 million people dying from this pandemic. So that was the figure that was thrown in March 2020. And as you know, we are very far from such a figure, fortunately. because all of a sudden, people realized that the sanitary dimensions of the crisis in Africa were not exactly what everybody more or less predicted or expected. And then the explanation started to be thrown. First, it was, it has young population. Well, it has some merit as an argument, because a lot of people that suffer from the virus lethality are the people with comorbidities. So those comorbidities, normally you develop them as you age. So younger people have less comorbidities. So if the comorbidities are so important for the lethality dimension, it is normal that Africans will, with their average population age of 19, be a bit more protected. Then the second argument was that maybe because we have been quite exposed to pandemics, people have been administering cocktails of pharma that may have an impact in protecting Africans with some degree of resilience. For instance, those who have been treated for HIV/AIDS, or those who have been treated for malaria, and so on. So they have sort of a certain degree of resilience. Then the third explanation was climate. No, maybe, this virus likes cold more than, the kind of temperatures you'll find in tropical areas. Therefore, Africa is protected. As we know, that's not the case, because Brazil is one of the countries suffering the most, and they have the same climate as in Africa, and India also has very high rates of infection, much more higher than Africa, and has also a similar climate to most parts of the continent. So, but the point is, there were lots of justifications for why the sanitary dimension was not so devastating, but very few pointed to the direction that Africans were the fastest in putting in place the measures to respond to the pandemic. For instance, the number of countries in Africa that actually went to full lockdowns before they had one single death was 7. And we had a number of countries, about 20, that went into severe lockdowns way before they got into an average of 10 infections per 1,000. So as you can see, the governance of the pandemic in Africa was quite robust. And the reason is easy to explain. Because Africa suffered from pandemics before, and sometimes has not suffered directly because it had a pandemic in a given country, but because it suffered from the impact of the narrative about the pandemics. Like, for instance, when we got Ebola in West Africa, it was mostly 3 countries, Sierra Leone, Liberia, and Guinea. But, the entire sub-region was submerged by negative narratives and had to put in place the same measures as if they had Ebola, which they didn't. So there was this preparation psychologically to respond quickly, because we are going to suffer, even though, the data and the statistics were not there to prove that it was so devastating. The second very interesting development that took place is that most of African countries went to, by default, to the mechanisms that do not necessarily need hospitals and very sophisticated equipment. They went to community type of responses, because that's in most countries, the only thing they have actually. The hospital structure is very poor. So you go into the community dimension and the communication dimension and the tracking within communities, which is much more easier. And Africans normally, when they deal with this type of phenomena, the authorities, even without the scientific knowledge, resort to recommending hygiene type of measures. It doesn't mean that it was completely followed, but it's just to give you a sense that the type of responses in Africa, with very limited means and very limited possibilities, if the pandemic had actually been as strong as, let's say, in Europe, did play a very important role in reducing the sanitary crisis. Now, what I think it's even more interesting is that a number of countries, because they realized they had to put some social protection measures in place, went into some innovation on social protection that is now going to stay. Like, for instance, a number of countries introduced mobile applications for dispensing social protection related measures, which has never been tested before. And now it's not going to go away. It's there. It cuts a lot of intermediaries, and it is very fast and very reliable, much more transparent. So some of the databases that were necessary for this to happen are the result of very strong investment that Africans did over the last 20 years on mobile payments. And you know, the region is the most advanced on mobile payments in the world in percentage terms. So Kenya is the world leader, and Africa represents about 50% of mobile payments in the world, and 50% is the rest of the world. So it is one clear example of leapfrogging. You know, you don't have the structures, you don't have the agencies, the banking, etc. You just leapfrog directly to the latest possibilities offered by technology. But that's not what I want to tell you about. Most of you actually know about this. So the sanitary dimensions be what they were. The question is, was Africa therefore, after the 1 year of pandemic, in a better shape than the rest of the world? No, the opposite actually happened. And it happened for three reasons. The first reason is because Africans are so dependent on externalities that if there is turbulence in the world, they are the ones that suffer the most. So therefore, there was less access to capital. So all these stimulus packages that everybody could put in place, Africa could not. The volatility of the currencies in Africa was much higher than the rest of the world. The opportunities that were normally associated with foreign direct investment dried up because, you know, the investors were not very interested to come to Africa during a pandemic period, and so on and so forth. So it suffered first because it is too much dependent on externalities, and therefore, it doesn't matter how well you manage the sanitary dimensions. You can't really afford to have the economic stimulus that is needed for coping. The second reason why it has gone bad is because we have levels of informality that are too high. And those levels of informality basically mean that when people are confined and social distancing measures are in place, the informal economy is paralyzed completely. And a lot of the survival arrangements that exist in the continent depend on mobility. And therefore, you know, the lack of mobility has a much higher cost with informality than it has with formality. And that you know, I will give you the classic example. We are here having this meeting because we can afford the internet, we can afford to pay, you know, sort of the equipment that allows us to continue to work. That's formal. But, you know, in the informal sector, this is much more difficult. And therefore, you know, they're kind of the first to be hit and the last to get out. And then the third reason why we suffered also a lot is because the little margin of maneuver that African governments have, because their fiscal space is very reduced, right? The little margin of maneuver that they have has been sort of the subject of a mindset where they, and this they refers to African governments, where they are not capable of questioning the macroeconomic orthodoxy at a time where the rest of the world is doing that. So if you look into any response from a rich country all the way to some of the emerging economies, the most important measures that they put in place were associated with the defiance of macroeconomic orthodoxy. Like, for instance, central banks reducing their interest rates all the way to zero. That's one example. Or making sure that, you know, you regulate certain types of transactions that are not respectful of the WTO because, you know, they are protectionist. You can go on with the list. So everything was being questioned. But the Africans were trapped in not wanting to misbehave because they have paid the price before so many times. They were sort of scared of being innovative in this field. And that is, it's very tragic because it reduced most of the discussion about the response of the pandemic to what others could do for Africa. And the two key examples are how they could help with vaccines and how they could help with debt. So let's just focus on those two quickly. Helping with vaccines, it's basically establishing a mechanism where rich countries can contribute to a pool that will help Africans get free access to the vaccines. And that is called the COVAX, and it is led by the WHO. The problem with COVAX is that COVAX is a last resort, meaning the same pharmaceutical companies that are going to provide vaccines to COVAX, and no matter whether you have the money or you don't have the money, are going to negotiate first, providing their lots to the one that pays more. And therefore, rich countries negotiate on the side to make sure that they are the first to get them. And then, you know, COVAX will get some. COVAX so far has been able to administer less than 2% of the needs in Africa. And it's going to continue like that, according to the projections that are made by the economists. Most likely herd immunity levels of 60% will be attained in Africa through vaccination only in 2024. And that is not really very surprising because that's the way, you know, the pharmaceutical companies behave. They received $14 billion of public money to develop the vaccines, $14 billion. And yet they are, you know, just negotiating the sale of those vaccines on a commercial basis, ignoring the 14 billion that were subsidies for the research. Now, obviously, you can say, what is the solution? The solution was a resolution introduced by India and South Africa at WTO to have a waiver of the patents for these vaccines because they have been developed with a lot of public money, and because, you know, we have to give opportunities for the manufacturing of these vaccines in different parts of the world to have a quicker response and a cheaper price. But this has been opposed by the EU, by Japan, by the US, by the UK, because, you know, they are the owners of the main pharmaceutical companies. And they say, no, as a compensation, we will give money to COVAX. Or, you know, the G7 decision that please give your extra vaccines to COVAX. Like, for instance, Canada has already bought the equivalent of 5 times the needs of Canada for vaccination of the entire population. So what are they going to do with that? Nobody knows. But, you know, this gives you an idea that what was broken before, which is this lack of global governance, has just manifested itself again by lack of solidarity and by lack of having a mechanism that really is respectful of the parameters of global public goods. Then you have the debt. It's more or less the same story.
Yeah. I'll let you finish on that, and then I want to come in and ask a couple of follow-up questions.
Sure. On the debt, it's more or less the same story. You have the G20 initiative. I'm not going to get into the technical details. That basically promises to deliver some relief to Africa. But when you go and trash down exactly what has been done during the year 2020, it was $5 billion. $5 billion is really a ridiculous amount. You know, when you know that the amount that the IMF alone has put at the disposal of this pandemic was $3.9 trillion. So you can see that Africa is really at the short end of the stick, and that's how we are at the beginning of 2021. We have avoided a complete disaster of 5 million deaths on the sanitary side, but we are in dire straits when it comes to the economic side.
Well, okay. No, that's an amazing overview, Professor, about just where we are right now and what some of the structural weaknesses were that, you know, lead us to this current situation. So thank you so much for sharing that. What I would love to hear from you now is, are we still, yeah, we still have the internet a bit weak. What I'd love to hear from you is, given some of these constraints that you've outlined, especially from the economic and fiscal perspective, what's the prognosis for the building back better? You know, that's the phrase that we hear now, that after the pandemic, you know, countries should try and build back better. Do you think there's anything from a governance perspective within the Africa region that has worked well? If you look at our regional institutions, for example, do you think that they've taken a lead and shown some leadership? What do you feel could be some silver linings for us when it comes to building back better? Or do you think that the constraints that you outlined are so huge that there's very few, you know, options for us to be able to do better post-pandemic?
No, I think we stand a very good chance, because the broken dimensions of the crisis of international governance do open opportunities for Africa if we know how to seize them. There is one demonstration of agency on the part of Africa, which is to not let down the continental free trade area process during the pandemic. So that was a very strong signal that, you know, we'll continue to negotiate, we'll finalize the protocols, and the continental free trade area enter into force January 1st, 2021. That is a very strong signal of building back better, because that is going to create opportunities for regional value chains, some protectionist measures that are compatible with international trade rules, etc. A second demonstration that I think allow us to be optimistic is the fact that, as I mentioned, we have introduced social protection measures that are quite innovative and are here to stay, and are going to rebalance a bit the inequality in our societies. And this is going in turn to provoke a new research of domestic resources that were neglected until now. The key example for me is pension funds, because the pension funds have about $1 trillion in Africa. They are not properly managed, except for a few countries. It's a huge reservoir of capital that is there not to be tapped, but to be used productively. Then a third example of building back better, being also possible in Africa, is the fact that all this lingo about debt, in fact, camouflages a more interesting development in the world, is that after 1 year of pandemic, there is a lot of capital out there that is waiting for a possibility of a quick buck. And the levels of risk-taking are going to increase considerably, because people have not been able to deploy capital for about a year. And it's a lot of money because the stimulus packages have put a lot of money in the pockets of investors indirectly, because they've sustained, sort of their businesses indirectly. And I think if Africa just gets slice of this, it's going to be enough to propel its economic recovery. And I'm very optimistic that is going to happen in 2022. I'm not very optimistic for this year, because I think there are too many unpredictability dimensions that continue to bring back the old narrative about Africa. But I think it will go away, because the fundamentals of Africa are not that bad. The opportunities are huge. And I think, the risk-taking behavior is going to change and make things better in 2022.
Thank you. That's very good news. And I think just what you said about, countries holding on and ratifying the African Free Trade Continental Agreement and so on, shows the maturity in terms of the leadership, being able to hold on to the things that are important for the continent. So I just want to do a time check with Karine and Zaninka, because we're at 5 to 7. Would we be able to go on a few minutes with this WebEx platform so that we can also get a few questions from participants?
Yes, absolutely. And please, the public, if you have any questions, please ask them in the Q&A section.
Okay, fantastic. Professor Lopes, is that all right with you if we go on until, say, 10 past, quarter past, so we can get a few more questions from participants?
No problem.
Fantastic. Okay. So if anyone has questions, I'd like to invite you now to just put them into the chat, and then I can help direct them to Professor Lopes. So while you do that, I'm going to ask you one more question, Professor. Back to the issue of governance, but this time coming more to political, civil governance within the continent. I'd love to get your thoughts about what you feel how the pandemic has impacted democracy governance on the continent, if you think it has. One of the concerns early on, you mentioned the challenge of informality. One of the concerns early on in the pandemic is that there would be riots and protests and civil disorder because of the economic impact, and that population wouldn't be able to cope, and governments would be repressive. We had a little bit of that, but I don't think it was as bad as, some people had forecast. What are your thoughts around that political governance democracy piece?
Well, I think some organized crime and organized terrorist groups took advantage of the pandemic to expand their operations, because the climate was very favorable for them to do so. With most of the governments very much concentrated in the response to the pandemic, and the deterioration of the socioeconomic conditions was a very fertile ground for them to, expand their operations. But the civil unrest that normally is associated with social distress, particularly in urban areas, was not as bad as most predicted. Despite the informal sector, for instance, being severely affected, people did not go on a complete, sort of manifestation of their displeasures and they didn't shatter the functioning of societies. You have some manifestations here and there that have taken a political dimension, but what is fascinating is that Africa during the pandemic was probably the continent with more elections than any other region. So you could have expected that some of these elections would be postponed. Very few were, and the levels of participation were lower than normally they are. But the fact that most governments felt that they had to stick to the elections is because they are conscious that under a pandemic context, lacking legitimacy was going to be even more difficult for them. So they needed some sort of legitimacy, even though, you know, the elections will not be completely transparent, or in some cases with the levels of participation that are required. For them, it was at second best, or it was sort of the less worse, and they went for it. So I think the political developments in the continent are a bit surprising. Mo Ibrahim Governance Index had mentioned the deterioration of the governance in the continent for the first time in 10 years. So it's very important to take note of that. But the index is a composite of 30 indicators, and a lot of them have to do with the socioeconomic dimension. So we have to read carefully through the details to be able to understand the full complexity.
That's right. And the prize, you know, for leadership was awarded to the head of state of Niger. And there have been times when the Mo Ibrahim Index has not awarded any, you know, the foundation has not awarded any prize. So the fact that they still felt that, you know, there was a deserving leader despite these troubling times is also, I think, a positive testimony. So we have a question from our participants, which relates, I think, to what you mentioned about the WTO exemption in terms of licensing for manufacturing of the vaccines. So someone said, as head of WHO, seems to be in favor of the waiver for the vaccines. Are you hopeful it might be accepted by the EU, US, etc.? Are you able to come back to that, Professor?
Well, you know, it's a bit like some people putting too much hope that the WTO new DG is an African. Yes, it's important to have African leaders in these organizations because they are symbolically a demonstration that Africa has come to age and, you know, has to be respected as in its normalcy, But these leaders cannot decide on these matters. This is government negotiations are very complex, and WTO negotiations have not yet evolved to the point of accepting the proposal from India and South Africa. Now, I will tell you two things. One is that when we had a number of African countries requesting the same for antiretrovirals for HIV/AIDS, it took the WTO 10 years of negotiations to accept it, to accept the waiver. And in the meantime, 17 million people died. So I doubt this is going to happen in the next 2 months or 3 months. It will take years. Eventually it may happen, but it will take a lot of effort. The second thing that so that's the negative story. Now I want to tell you a positive story. The positive story is that on that, the solution that most African countries were asking was for the IMF to issue what is called the special drawing rights as a way of putting cash in the hands of African countries. And this is something that the IMF in its statutes can do in moments of crisis. And think of a crisis bigger than this one. It's the worst economic situation since the Great Depression. But there was a refusal. And the refusal was mostly led by the US administration under Trump. Now, guess what? The administration changed, and this week, the US has manifested its willingness to actually go in the direction of the special drawing rights. So just in a matter of weeks, the change in US administration is making possible to tackle the debt issue in a completely different perspective. So that's the positive story. So let's hope we'll have something in between.
Yes, indeed. No, thank goodness. I know the SCRs has been a big issue since the pandemic started. Back to the vaccines, I'd love to ask you a follow-up question about the issue of African production of vaccines, because I think what the situation has also exposed is the fact that, you know, as a continent, we have not had the scientific capacity to be able to be more reliant and to swing into gear, you know, as India, for example, has done around manufacturing. What are your thoughts on that, and how important do you think this issue will be as part of the Build Back Better debate and empowering Africa for future pandemics and just, you know, future economic self-sufficiency? How important do you feel this element is?
The cheapest PCR COVID test in the world is the one developed in Senegal for $1. Protective equipment was introduced first in Morocco before it was possible to produce protective equipment in Europe. The number of innovations that we saw in this field in Africa during the pandemic is astounding. So the African Academy of Sciences and the Center for Disease Control, a new institution of the African Union based in Addis, have paired their efforts to promote the idea of having manufacturing of vaccines in Africa. Now, which countries already have possibilities of producing vaccines? There are actually 3 countries in Africa that can produce vaccines immediately. One is South Africa, another is Morocco, and the third is Egypt. And I think it is possible, if there was a waiver, it was possible for these 3 countries to produce enough vaccines to most of the African needs. South Africa, through its pharmaceutical giant Aspen, is going actually to produce vaccines for Johnson & Johnson that are going to be exported out of Africa because they have the patents. And, you know, although Aspen is going to produce them, they cannot, Aspen is not the one selling them. They decide where it goes. So the South African government has managed to get part of it, but most of it is going to go outside of Africa. So that's very sad, but also reconforting that we have the capacities, but we don't have the policies and the regulations. So we need to put those in place. And that has to be a joint effort. And I think these initiatives of the Center for Disease Control are very promising. Certainly, we have learned from the protective equipment, the ventilators, and now the vaccines, that if Africa doesn't have a solution for its own sort of health strategic needs in times of crisis, it's left alone.
Right, correct. And talking about Africa Centers for Disease Control, this is a relatively new institution that was just created a few years ago. And if we didn't have it, I don't know where the continent would be, right, with the management of the pandemic. What do you feel is, you know, what role do you think African leaders could be playing, as well as others, private sector and so on, in supporting an institution like the Africa CDC and really highlighting the importance of coordinated research, you know, surveillance, and so on in the continent? Do you think we're giving it its rightful place, or do you think there's a bigger agenda that needs to be supported?
Well, you know, the CDC is the result of Ebola. So when the Ebola struck, Africa found itself not prepared to have an African response to the pandemic then. But it put together a number of initiatives. And, you know, I was at the time in Addis Ababa, and I was very much part of the discussions to have a private sector response from Africa to Ebola, to mobilize volunteers to go into these countries from countries that had some experience with Ebola, particularly DRC and Uganda. to make sure also that we needed to have some coordinating efforts at the continental level to deal with issues such as that. And the result of all these discussions was a resolution at the African Union Summit that we need to be better prepared for this type of crisis and challenges. And in that resolution, the proposal to establish a CDC. Guess what? Now it was the CDC that saved us. It's not yet fully equipped, but it is very interesting. If you read the newspapers that are assessing the responses at the global level, they are all very much praising the fact that Africa was much better organized, let's say, than other regions, because it had a coordinated approach. One of the manifestations of that coordinated approach was the initiative by CDC with Afreximbank to have joint procurement of equipment, ventilators, and now it's going to be rolled out also for vaccines. So this is very encouraging, but it's the early stages of a structure that needs much more support. And I find it very interesting that a lot of people will not discuss how CDC was born in Africa, how we can support the structure, but everybody seems to be fixed on the fact that we have a very nice building being finalized in Addis that is going to host CDC. It's quite an impressive structure funded by the Chinese. And because it's funded by the Chinese, and they had already funded the African Union headquarters, so this is the news, not the content, but the form.
Yeah, and we know that when the pandemic hit, I think there were only 2 countries in Africa that had the ability to actually diagnose, COVID. And because of the Africa CDC, that was spread to all the countries in Africa. So that happened in the space of, I think, a few weeks, right? That the Africa CDC empowered countries. So it's huge. Like you say, we couldn't have survived without it. Okay, first, let me just see if anyone else has another message, including from my fellow conveners, if any of you would like to get a question in before we wrap up. Anna, Karine, Saninka.
I see that Christina has her hands up. I don't know if she wants to ask a question or if it's something wrong. I can open the camera of everyone if you want. We can try that.
Christina, did you have a question? Do you want to put it in the chat? I want to be democratic and make sure anyone who'd like to get something in has the opportunity. So if not, because I am mindful that it's getting late. Anna.
Yeah.
Anna has a question, yeah.
Go ahead, Anna.
Yeah. I wanted to ask, I sent in a question, but maybe it was lost somehow. I wanted to ask Professor Lopes about this Building Back Better, about the future and about a constructive future. And what I perceive as one of the very main problems in Africa, especially perhaps in South Africa, is unemployment. In South Africa, we have, depending on how you measure it, maybe 35 or 38% unemployment. And I think there are policies that can be implemented also with respect to the environment. And I would like to hear your thoughts about that. What can governments, for example, the South African government, do about the unemployment when we have now this opportunity to build back better after the pandemic?
Well, the reason why you have such a problem in South Africa and in other African countries is because we don't have enough industrialization. Because when you have the manpower situation that is emerging in most African countries with a demographic transition that is taking shape quite late. Demographic transition is when your fertility rates attain a certain level, then start going down. And we are at the peak of that. So you have a boom. The only way you can absorb such quantities of people entering the labor force is by basically having a level of formalization of the economy that is tantamount to introducing industrial type of relations. And it's very important for us to mention that industrialization is not equal to manufacturing. So industrialization is about industrial type of relations, not necessarily manufacturing, not necessarily smokestacks. It can be, the tourist industry, just to give you an example. But you need that level of formalization of the economy. And what is happening in Africa is that we are missing that transition and we are going straight into where most countries are going, which is a huge value of the economy coming from services sector. But the problem with the, going directly into the service sector before you have industrialization is that you have a lot of value in the service sector, but not a lot of employment. For instance, in South Africa, 25% of GDP comes from the financial sector. 25%. Only 6% comes actually from mining, contrary to perceptions in this country. And you can imagine the financial sector, as sophisticated as it is, and is responsible for a great value for the economy of the country, does not employ that much people. So you have that difficulty in most African countries, where you will have most of the value that is growing fast in the telecoms and the financial services, but not employing enough people. So we need industrialization. Now, people may say, but how can you industrialize at a time where there are so many constraints, for industrialization? You have automation, you have robotization, you have climate-related constraints, you have regulatory constraints, you have intellectual property constraints, you have trade-related constraints. So you can go on with the list. Normally, what people don't mention is that there are also quite significant opportunities that are unique to Africa. One of them is the fact that if you have a continental free trade area, you can build regional value chains and national value chains for the larger countries in areas where the consumption is going to boom. And one of them is agro-industries. Because, you are going, you have a disposable income. First thing you do is to invest on agro-processed goods. So that's a unique opportunity. Right now, Africa spends about $54 billion a year importing food. It has 60% of the unused arable land in the world. It has only 9% of irrigation of its agriculture. And you can go on with the statistics, so the opportunities are there. That is what is going to create employment. If you have, like we do right now, about 20% of our income in the continent coming from agriculture, but we employ 60% of the people there, 60% for 20%, there you go, it's your poverty and your unemployment. So we need to structurally transform the economies. Now, the problem is that to transform structurally the economies, you need very strong and sophisticated leadership. Some countries in Africa have it, but most don't. So that's the challenge.
Right. So it comes back to leadership, and enlightened leadership in terms of taking advantage of the assets that we do have in the continent. So thank you, Professor, for the response to that, for just being with us for this hour. I can't begin to say how enlightening, how insightful this discussion has been. I must say on behalf of everyone that we're truly honored to have you as one of the alumni of the Graduate Institute. I'm sure everyone who's been on the call can join me in just saying, how lucky we are to have someone of this stature with this insight and knowledge. And thank you for, agreeing to join us tonight. And we hope that we'll be able to call on you another time as we continue to build our alumni network in the Africa region. We'd love to know that you can be an ongoing resource and support and share these kinds of insights with us. As you know, many of us work in these areas of international development, international economics and relations. So these insights help us to do our work better. So we really appreciate it. Thank you so much. Thank you, Zanenka Karim, for your collaboration through the Institute. And thank you, Anna, for helping us get this going. And thanks to all the participants. And we hope to see you again soon. Thank you, Professor.
Thank you. Thank you for the opportunity.
It's a pleasure. Muito prazer.
Obrigado.